All right, we've made it out of the autonomic drugs, and it's time to move on to cardiovascular renal pharmacology. In this chapter, we're going to cover a few drugs used in heart failure. I know what you're thinking. Heart failure, why does that sound so familiar, and why does Andrew's voice sound so different? Anyway, in our previous beta blocker symphony sketch, we already covered a few cardioselective beta blockers that were especially useful for treatment of chronic heart failure. Remember that sad-looking floppy heart balloon underneath the A-beam spotlight? Our recurring symbol for heart failure therapy? At center stage, we also showed that beta blockers actually prolong life in these patients, as depicted by the angel harpist, our guardian angel for improving survival in patients with cardiovascular disorders. In this sketch, however, we're going to cover a drug that doesn't provide a survival benefit, digoxin, a cardiac glycoside used to reduce symptoms of chronic heart failure. You know, all this talk of a floppy broken heart reminds me of only one thing: senior prom. I don't know about you guys, but my teenage years were like something straight out of a John Hughes movie. There were the nerds, the popular kids, the wastoids, the jocks, and it was all about making an impression at the high school dance. So, let's start our discussion with digitalis, the genus of plants from which cardiac glycosides are derived. These natural positive inotropic agents have been around for thousands of years. It was in 1785 that William Withering first described the clinical effects of the purple foxglove plant. Well, fast forward to the rad future of 1985, and you'll see that we've hired none other than DJ Foxglove for the event, setting up a sweet Tears for Fears mix, no doubt. The word DJ should remind you of the name digoxin, the prototypical cardiac glycoside, and the only one approved in the United States for symptomatic treatment of chronic heart failure. At the molecular level, all cardiac glycosides, such as digoxin, inhibit sodium-potassium ATPase at the cell membrane. This inhibitory action is largely responsible for the therapeutic effect, as well as many of the side effects of digoxin. But how does this lead to increased contractility? Well, take a look through the door of the gym and you'll see that this high school jock has knocked over a vending machine outside. It's a potassium banana vending machine, powered by 3 ATP batteries. And it's our recurring symbol for membrane sodium-potassium ATPase. It'll become a more prominent symbol in our chapter examining diuretic effects at the nephron. For now, just imagine it as an ATP-driven potassium pump. Usually responsible for pumping 2 potassium ions into the cardiac myocyte for every 3 sodium ions pumped out, this ATPase is now inhibited as depicted by the school supervisor as he rushes over, only to find the door obstructed. And if potassium can't enter the cell, sodium can't leave it. See the sodium-ridden salty peanut snack in the supervisor's hand? Principal Vernon, in his usual party pooper fashion, of course, has made sure this is a dry party, and the only food available is peanuts, our salty, sketchy symbol for sodium. This buildup of sodium at the door represents the increase in intracellular sodium concentration as a result of sodium-potassium ATPase inhibition. Hold that thought, because this increase in intracellular sodium actually prevents calcium from leaving the cell via the sodium-calcium exchanger. This is because digoxin lowers the sodium concentration gradient, which is normally responsible for driving calcium out of the cell. To illustrate this mechanism, we have a student so focused on his sodium-salted peanuts that he's blocking the revolving door. But more importantly, he's preventing this calcium ice cream guy from leaving the event. Awkward. Remember, calcium is our sketchy symbol for calcium. All this increased cytoplasmic calcium leads to a rise in sarcoplasmic reticulum calcium stores, resulting in improved myocyte contractility and left ventricular systolic function. Take a look back at the jock who had initially set off this chain of events by inhibiting our sodium-potassium pump. He's flexing his muscles to remind you of cardiac glycoside's net effect of increasing cardiac contractility. Because of digoxin's positive inotropic effects, it can be used for symptomatic treatment of chronic systolic heart failure. So we've brought back our recurring heart failure symbol, that failing and deflated heart balloon. as sad-looking as our young prom attendee here, stood up by his date yet again. One thing to reiterate here is that digoxin does not reduce mortality in patients with chronic heart failure. It's used only for symptomatic relief, and because of its narrow therapeutic index, it's usually given only when diuretics and ACE inhibitors have failed to control symptoms. The narrow therapeutic index means we also need to measure digoxin levels, but more on that later. Besides heart failure, digoxin can also be used to treat certain arrhythmias. This is because digoxin exerts parasympathomimetic effects via central vagal stimulation, as well as facilitation of muscarinic transmission at the cardiac myocyte. Direct stimulation of the vagus nerve is highlighted by the sign displaying the theme of our prom, Fabulous Las Vegas. And because cholinergic innervation is much richer in the atria, these actions affect the atria and AV node conduction most, making digoxin useful for treating atrial arrhythmias. For instance, in some patients, digoxin is used to treat chronic heart failure due to systolic dysfunction, as well as their concomitant atrial fibrillation requiring rate control. Because of digoxin's antiarrhythmic effects, let's include our recurring symbol for antiarrhythmic agents, a rhythm-inducing record, of course, getting spun by DJ Foxglove. Stay tuned for more info on digoxin's antiarrhythmic effects when DJ Foxglove makes her return in our antiarrhythmics chapter. But we're at the prom, so let's live in the now. Because of digoxin's narrow therapeutic index, toxicity is common, so as expected, adverse effects from digoxin are related to its plasma concentration, though very few occur below 0.8 micrograms per liter, 1 nanomole per liter, with toxicity more common above 2 micrograms per liter. In fact, exam questions will often focus on digoxin side effects rather than clinical indications because of just how common and characteristic these adverse effects are. Let me set up the classic scenario. A patient visits your office who is on multiple medications and has a history of heart failure and AFib. Red flag there. And you're presented with some pretty characteristic findings. First of all, his lab values are showing elevated potassium. Remember that dumb digoxin jock who knocked over the sodium-potassium ATPase? Well, the resultant reduction in potassium influx leads to elevated serum potassium levels, depicted by this tall pile of potassium bananas. Hyperkalemia is an important marker of acute digoxin toxicity and is even a predictor of mortality. Also, although your patient has a history of atrial fibrillation, his EKG is showing you some fresh new beats. Premature ventricular contractions are the most common rhythm disturbance seen in the setting of digoxin toxicity, though virtually any type of arrhythmia can be encountered. See the heart-shaped dance floor? Let these students get in their running man on, represent the various rhythm disturbances precipitated by digoxin toxicity. These arrhythmias are potentially fatal, thus continuous cardiac monitoring and serial electrocardiograms are performed in the setting of digoxin toxicity. One other thing to look out for on that EKG is the so-called digitalis effect, seen with chronic digoxin use. It consists of T-wave changes, QT interval shortening, ST depression, and prolonged PR interval, though probably the easiest thing to notice are those classic scooped concave ST segments. See the tasty ice cream getting scooped into those in no way intoxicating beverages? Well, we've highlighted the letters ST, and we've also shown our underage high schooler leaving little concave scoops out of the ice cream. Keep in mind that these chronic EKG changes don't necessarily indicate toxicity or myocardial ischemia, just long-term use. Okay, back to that digoxin poison patient who's arrived at your office. He's probably going to be bradycardic. Remember that vagus sign? Because of increased vagus nerve activity at the SA and AV node is hindered, which can lead to bradycardia and various degrees of AV nodal block. Take a look at young John Cusack over here, hopelessly waiting for his date to arrive. Musical notes are our recurring symbol for cardiac nodes, and notice that he's standing right on that SA node. Also, let his heart-shaped pocket watch woefully dangling toward the floor remind you of bradycardia caused by parasympathetic activity at the SA node. Whoa, Look over there, that guy trying all his moves on that classy lady in the prom dress. Ooh, rejected. So awkward, but they're standing right where the AV node would be, highlighting the excess cholinergic action on the AV node in the setting of digoxin toxicity. This can lead to heart block, represented by the heart shield pendant worn by the girl who's blocking his tactless advances. Remember this effect on the nodal pacemakers. Digoxin is contraindicated in patients with significant sinus and atrioventricular block. See that do not block sign at the back door of the gym? Digoxin should be used with caution when taken in combination with other drugs that depress sinus or atrioventricular nodal function, such as beta blockers, hence the beta highlighted in the word blocked. During acute digoxin poisoning, a patient may remain asymptomatic for several hours before developing significant gastrointestinal symptoms. These include nausea, vomiting, and abdominal pain, depicted by the student here, who's been out on the dance floor for several hours, showing off his Kevin Bacon, now looking a little nauseated. Neurologic manifestations such as confusion and weakness are also common, especially with chronic toxicity, when patients can present to you with lethargy, delirium, and disorientation. Digoxin toxicity can also lead to all kinds of visual changes, even alterations in color vision. And you know what? Those visual disturbances are so classic, especially on the exam, that we'll highlight them here as the dancer blocks his eyes from the bright lights of the dance floor. Specifically, xanthopsia, or objects appearing yellow, is a hallmark sign of digoxin poisoning. And that's why we've made the spotlight a nice, bright April O'Neil yellow. All right, there are a couple predisposing factors to keep in mind that can increase the susceptibility to the toxic effects of digoxin. One of them is hypokalemia. I know what you're thinking. I thought digoxin caused hyperkalemia because of inhibition of the sodium-potassium pump. Well, turns out that several electrolyte abnormalities, including hypokalemia, exacerbate digoxin toxicity. This is because hypokalemia actually increases digoxin binding to the sodium-potassium ATPase. Take another look at our scene outside the gymnasium, and you'll see that another jock has stuffed one of the freshmen into one of the potassium banana vending machines. Think of this vending machine as being potassium depleted, and that's why there's room for this digoxin bully to pull the old stuff the first year in the locker gag, representing increased toxicity, if you will. Loop diuretics to treat heart failure are the most common cause of hypokalemia in these patients, but other causes of hypokalemia, such as diarrhea or vomiting, do occur. Renal insufficiency can also increase patient susceptibility to digoxin's toxic effects. In fact, renal dysfunction is commonly encountered in the setting of chronic digoxin toxicity and is often what precipitates the rise in the digoxin concentration. So, when dosing digoxin in renal impairment, a lower dose is required. So given that, we've sketched in another punk senior from a rival high school who's crashed the party. Take a look at the jukebox he's overturned. Suspiciously kidney-shaped, right? As he jams that flagpole into the kidney, let it remind you of renal damage. And that long tapering flag should evoke an image of the greatly extended serum half-life of digoxin in the setting of renal insufficiency. Assessment of renal function is essential in these patients and should include measurements of BUN and creatinine, as well as urine output to assess renal perfusion. Renal clearance of digoxin can also be inhibited by other medications, including amiodarone, verapamil, diltiazem, quinidine. These drugs slow or inhibit elimination of digoxin, leading to increased serum concentrations. Since a lot of these medications have some use as antiarrhythmics, let's sketch some records falling out of the kidney jukebox underneath our renally dysfunctional senior, which highlights our recurring sketchy symbol for antiarrhythmic agents. Some rhythm-inducing records. On the exam, just remember that numerous factors affect digoxin serum levels, especially kidney function. Early recognition of digoxin toxicity is essential. The treatment for any clinically significant arrhythmia from digoxin toxicity is digoxin-specific antibody fragments. or digoxin immune fab. Remember that sign highlighting our vagal vagus-themed dance? Let the word fabulous represent those digoxin immune fab antibodies that are used to reverse toxicity caused by all that extra digoxin. All right, it's that time. Let's sum up this teen rom-com into a few important points. Digoxin is a cardiac glycoside used for symptomatic treatment of chronic heart failure. It works by inhibiting sodium-potassium ATPase at the cardiac myocyte cell membrane. This inhibition of sodium-potassium ATPase causes a rise in intracellular sodium, which in turn prevents calcium from leaving the cell. More calcium means more contractility, makes digoxin useful for treating left systolic dysfunction. Besides heart failure, digoxin can be used as an antiarrhythmic through direct stimulation of the vagus nerve. This affects SA and AV node conduction, causing bradycardia and AV nodal block. The side effects of digoxin overdose are classic and include hyperkalemia, numerous arrhythmias, as well as GI symptoms, and even glaring yellow visual disturbances. Hypokalemia increases susceptibility to these toxic effects. Watch out for renal dysfunction, which can precipitate a rise in digoxin concentrations with lower doses used when renal dysfunction is present. And finally, remember digoxin immune fab, the first-line agent for treating clinically significant arrhythmias from digoxin toxicity. Well, I don't know about you, but I'm going back out on that dance floor. Anyone seen my peanuts?